Imagine your dog seems perfectly healthy, then suddenly starts developing these painful, swollen legs. That sounds really bizarre, right?
It does. Very strange.
Today, we're diving into a condition called canine hypertrophic osteopathy, and what's truly fascinating, I think, is that this odd bone issue is often the body's way of signaling a hidden problem somewhere else entirely.
That's absolutely right. It's not just, sore legs. It's a clue.
Yeah.
It can be a real red flag that something deeper might be going on.
Mm-hmm.
And our source today gives a really thorough look at this condition in dogs. Quite intriguing.
So our mission for this deep dive is to really understand what hypertrophic osteopathy actually is, what could possibly trigger such a reaction in a dog's legs, and, well, why it kind of acts like a medical detective pointing towards other issues.
Yeah, finding that root cause.
Exactly. We want you to get a solid handle on this pretty complex topic, quickly but thoroughly. So let's start with the basics. What exactly is hypertrophic osteopathy?
Okay. So in essence, it's a disease that shows up in the distal extremities.
Meaning like the lower legs, the paws?
Precisely. The lower legs, paws, feet. And it stems from changes, alterations in the blood flow going to those areas.
Okay.
And this change in blood flow, it sort of kicks off a chain reaction. First, you get an overgrowth of the connective tissue, the stuff that supports blood vessels.
Right.
And then that's followed by new bone forming on the surface of the existing bone. We call that periosteal proliferation.
So the body's literally building new bone on the outside of the old bone in the legs because of something happening elsewhere.
That's the idea. Yeah, it's building this extra layer. And this new bone formation, it mostly happens along the long bones, the shafts, and in those distal parts we mentioned.
Uh-huh.
So specifically the tips of the toes, the distal phalanges, and then the metacarpals in the front paws, metatarsals in the back.
Got it.
And what's really interesting, actually, is that humans have a primary form of this called Marie's disease. Yeah. Which suggests there might be some, fundamental biological pathways involved that are shared across species. It's not just a dog thing.
Wow. That is wild. A human parallel. So, okay, who gets this? Is it more common in certain dogs? What's the signalment, the typical profile?
Well, we definitely see it more often in dogs than cats. That's clear.
Okay.
And the peak age tends to be around 8 years old.
8 years.
Yeah. And here's a really interesting correlation, that 8-year mark. It's also the peak age for neoplasia, for cancer in dogs.
Oh, wow. Okay, that's significant.
It is. Now, the average age overall for dogs diagnosed is about 5.6 years. But it's really important to remember it's not just older dogs and it's not just cancer. Younger dogs can get it, and dogs with non-cancerous lung issues can develop it too.
So it's not one single trigger then?
Definitely not. Multiple pathways seem to lead there.
Okay, so if you have an older dog, maybe around that 8-year mark,
Right.
and they suddenly get swollen, painful legs, that's something to really pay attention to. What are the first things an owner might notice?
Yeah, absolutely. Often owners will report their dog becoming lame. It might be gradual or it could come on pretty suddenly.
Okay.
And they'll show pain in one leg or maybe several. They might seem reluctant to move, stiff, don't want to go for walks. Or you might actually see a visible enlargement, a swelling of the lower parts of their legs.
Right.
Less commonly, but possible. If the root cause is in the chest cavity, you might see some respiratory signs too, like coughing or maybe some difficulty breathing.
And if they bring the dog in, what would a vet typically find on the physical exam?
Well, we'd confirm the lameness usually, and the dog would likely be sore, painful when we palpate, when we feel those lower limbs and paws. The enlarged areas themselves have a pretty characteristic feel. They're usually firm, quite taut, feel thickened under the skin. But, and this is important, they typically aren't soft and squishy like you get with edema, fluid swelling.
Oh, okay. So firm, not puffy.
Exactly. Firm. And as the condition progresses, that firmness, that thickening can actually extend further up the limb, proximally.
Yeah.
So yeah, those firm, enlarged lower legs are a really key physical sign.
Okay, so we've got this strange bone growth happening in the legs. Now, the really critical question, what's actually causing it? What are these underlying drivers?
Right. This is where the detective work really starts. The causes generally fall into two main buckets: neoplastic, meaning cancer-related, and non-neoplastic.
Okay, let's start with the cancer side.
Sure. And within that cancer category, it's actually a surprisingly wide range of tumors that have been linked to HO.
Like what?
Well, lung tumors are a big one, primary lung tumors, but also things like esophageal sarcoma, that's a cancer of the esophagus, rhabdomyosarcoma, which is a muscle cancer, adenocarcinomas, which are glandular cancers, originating in places like the adrenal gland, the liver, or even the prostate.
Wow, okay. Keep going.
Then there are kidney tumors like nephroblastoma or renal cell carcinoma, and even mesotheliomas, which are tumors of the lining of the chest or abdominal cavities.
That is quite a list, covering a lot of different body systems.
It really is. It underscores how this problem that looks like it's just in the legs can actually be the body's alarm bell for something serious almost anywhere else.
But you mentioned non-cancerous conditions too, so it's not always cancer, thankfully.
Correct. It's definitely not always cancer. We also see HO linked with non-neoplastic conditions, things like pneumonia, bacterial or fungal, lung abscesses or granulomas, which are inflammatory masses.
Okay.
Heartworm disease, diarrhea is another one. Congenital heart disease, something they're born with, or acquired heart disease later in life. Even things like foreign objects stuck in the airways, like inhaled grass seeds. There's a parasitic worm, Spirocerca lupi, that infects the esophagus that's been linked, and even just a localized collapse of part of the lung, which we call atelectasis.
So infections, heart problems, parasites. It really broadens the possibilities.
It does. It shows the body's reaction isn't specific just to cancer cells. It seems to be a response to significant, often chronic inflammation or space-occupying lesions.
Are there any other potential factors, maybe less common ones?
Yeah, there are a few others mentioned. Things like obscure toxins, though that's hard to pin down, high blood pressure, hypertension, an excess of estrogen, hyperestrogenism, and even a condition called congenital idiopathic megaesophagus.
What is that?
Basically, the esophagus is abnormally large and dilated from birth, and we don't always know why that's the idiopathic part.
Okay.
So these are less common links, maybe areas needing more research. And what's fascinating, really, is that the exact mechanism, how these underlying problems trigger bone growth way down in the limbs, it's still a bit speculative.
We don't know exactly how it works.
Not precisely. The leading theory involves increased blood circulation to the limbs, maybe triggered by nerve signals, perhaps involving the vagus nerve, or maybe hormones released because of the primary disease. It's a pretty amazing and somewhat surprising systemic effect from what might be a localized issue far away.
Okay, so a dog comes in with these symptoms, firm, swollen lower legs, maybe lame. How does the vet figure, okay, this looks like HO, and then, crucially, find that underlying cause? What's the diagnostic process?
Right, that's the key. First, you have to differentiate HO from other things that cause similar signs. That's the differential diagnosis list.
What else could it be?
Well, things like osteomyelitis, which is a bone infection, that can cause lameness and swelling. But osteomyelitis is often just on one side, asymmetrical. It might feel more like fluid swelling, edematous. And on x-rays, you might see bone destruction, alytic changes. Plus, there's often a history of trauma or an open wound.
Okay, so asymmetry is a clue there.
Yes. Also, bone cancer that has spread from elsewhere, metastatic neoplasia, that's also usually asymmetrical.
Got it.
In cats specifically, you can get bone changes from too much vitamin A, hypervitaminosis A, and again, usually asymmetrical, and it often involves the joint surfaces more directly.
All right, what else?
Then there are conditions we see mostly in young, growing dogs, which is a key difference from the typical HO dog. Things like hypertrophic osteodystrophy, or HOD, and multiple cartilaginous exostosis. Both of these affect the growth plates, the metaphysis near the ends of the bones, not so much the shaft like HO.
So the age and location on the bone help differentiate.
Exactly. And of course, you always have to consider simple wear and tear arthritis, degenerative joint disease, as a cause for lameness, though it doesn't typically cause that firm diaphyseal swelling.
Okay, so history, physical exam, maybe the dog's age helps narrow it down. What about lab tests? Blood work.
Standard lab work, CBC, chemistry panel, urinalysis can be helpful, but the results usually reflect whatever the underlying disease is. They aren't specific for the HO itself.
Ah, okay.
One thing we do often see, though, is a nonspecific increase in an enzyme called serum alkaline phosphatase, or ALP. That's often elevated when there's active bone remodeling going on.
Right. Any other tests?
Well, depending on what you suspect based on history and location, maybe a fecal exam to check for parasites like Spirocerca or heartworm testing. And ultrasound is really valuable. Abdominal ultrasound, sometimes thoracic ultrasound, can help find those primary tumors or other lesions in the chest or belly.
But it really sounds like imaging the bones themselves, like with X-rays, is going to be crucial here.
Absolutely fundamental. Radiographs X-rays of the affected limbs are key for the diagnosis of HO.
What do you see on those X-rays?
What's really characteristic is seeing bilaterally symmetrical, so usually in multiple limbs, and similar on both sides, and quite extensive new bone formation. It's happening on the outside surface of the bone shaft, the diaphysis.
Okay.
And this new bone often has this very distinctive look, sometimes described as palisade-like.
Palisade-like, like a fence.
Kind of, yeah. Imagine little spicules, tiny projections of new bone sticking straight out, perpendicular to the main axis of the bone, and it often goes all the way around the bone circumferentially. And another really important point, the joints themselves usually look normal. They're typically not affected by this peristeel reaction. That helps distinguish it from arthritis or other joint problems.
That's a key visual.
Yeah.
And then you'd also X-ray.
Yes, definitely chest x-rays, probably abdominal x-rays too, maybe ultrasound, as we said, to hunt for that underlying cause, the lung mass, the heart issue, whatever it might be.
Okay. Would you ever need a bone biopsy?
Usually not for typical HO. The radiographic appearance is often so classic. But if the pattern looks unusual or maybe asymmetrical, then yes, a bone biopsy and culture might be done to definitively rule out things like infection or primary bone cancer.
All right, so the vet's done the exam, the X-rays confirm HO, and maybe they found a suspicious mass in the lungs. What happens next? How do you treat this?
The most critical thing to understand about treatment is that you have to treat the underlying primary cause. The HO itself is a secondary sign.
So you don't directly treat the bone swelling?
Not usually. No, the focus is find the cause, treat the cause. So if it's a tumor that can be removed, surgery is the way to go, surgical resection of the mass. If it's an infection like pneumonia or a fungal granuloma, then you use the appropriate antibiotics or antifungals. Treat the heartworm, manage the heart disease, remove the foreign body.
Makes sense. Address the root problem.
Exactly. Now, there are some interesting, more unusual treatments mentioned for very specific situations, often related to lung issues where maybe surgery isn't possible.
Look what?
Things like surgically cutting the vagus nerve on one or both sides, that's vagotomy, or even making incisions into the lining of the chest cavity, the parietal pleura, or removing a section of a rib, superior steel rib resection.
Cutting a nerve to help bone growth in the legs, that sounds really indirect.
It is. It speaks to that speculative nerve-mediated pathway we talked about. These aren't common procedures, but they've been reported to sometimes help resolve the HO signs in select cases when the primary lung issue can't be fixed directly.
Fascinating. Okay, what about medications?
Well, again, medications depend entirely on the underlying cause, antibiotics, antifungals, heart meds, chemo maybe. But regardless of the cause, analgesics, pain medications are really important for supportive care just to keep the dog comfortable while the underlying issue is being addressed or if it can't be fully resolved.
Right. Managing the pain is key.
Yeah.
So let's talk follow-up and prognosis.
Yeah.
You treat the underlying cause. What happens then?
Well, because HO is so often linked to significant systemic disease, identifying that primary cause is just paramount. If you can successfully treat the underlying condition, remove the tumor, clear the infection, then the clinical signs of HO, the lameness and pain, they may resolve, sometimes quite quickly, actually.
Oh, it's good.
It is. But the bony changes themselves, the stuff you see on the x-rays, that can take a lot longer to go away, months, potentially, for the bone to remodel back towards normal. It doesn't just disappear overnight.
Okay. And the overall outlook?
No.
The prognosis.
Unfortunately, the overall prognosis is often pretty guarded, sometimes poor, and that's largely because neoplastic conditions, cancers, are such common underlying triggers.
Right, because the cancer itself carries a poor prognosis often.
Exactly. And sadly, even if treatment is initially successful, if the tumor comes back or spreads later on, the hypertrophic osteopathy can return right along with it.
Oh, man.
Yeah. And what's also quite remarkable and a bit frustrating is that there doesn't seem to be a strong link between the specifics of the primary tumor, like its size or exact location, or even its specific type, and whether or not a dog develops HO or if it comes back after treatment. It's still a bit unpredictable in that sense.
It really drives home how complex these interactions are within the body. How one thing, like a tumor, can trigger this seemingly unrelated dramatic response in the bones. So, for you listening, this whole deep dive into canine hypertrophic osteopathy, it really underscores that point, doesn't it? That a problem presenting in one area, like the legs, could actually be this crucial signal about something hidden, often serious, going on internally.
Precisely. It's that aha moment Realizing what you see on the surface might just be the tip of the iceberg.
So if an owner does notice this kind of swelling, that firm thickening in the lower legs, what's the level of urgency to get their dog checked out?
I'd say the urgency is pretty significant because those potential underlying causes, cancer, serious infections, heart disease, often need timely diagnosis and intervention to have the best chance of a positive outcome. Early diagnosis of that primary problem can really make a difference.
Absolutely. It really reinforces the complexity of disease in our pets and just the surprising ways different body systems communicate when something's wrong.
Exactly right. It's one of those conditions that really reminds veterinarians, and should remind owners too, to look beyond the most obvious symptom and consider the whole picture.
Okay, so just to quickly recap our deep dive then. Canine hypertrophic osteopathy. It's this really intriguing condition. You see new bone growth, primarily in the lower legs and paws, and critically, it often acts as a signal, a flag for underlying diseases, frequently cancer, but also infections or heart problems located somewhere else entirely in the body.
Yep. And diagnosis hinges heavily on imaging, especially x-rays, to see those characteristic bone changes and, most importantly, to hunt down that primary trigger.
It's a fantastic example of the body's interconnectedness, isn't it?
It truly is a reminder that sometimes a problem manifesting in one place is actually shouting about trouble somewhere else entirely.
So on that note, here's a final provocative thought for you to mull over. What other, maybe seemingly unrelated or subtle symptoms in our pets might actually be quiet clues, little whispers, pointing towards more significant internal changes that we might otherwise miss? And what does this whole phenomenon tell us about the incredibly intricate and sometimes surprising ways our bodies signal when things go awry?